one of the most important and I think exciting areas of kidney cancer has been the development of some new therapies to treat patients with newly diagnosed stage 4 recurrent or metastatic kidney cancer. These are the patients that maybe have undergone a kidney resection, and now the cancer has come back. And it may have come back right away. It may have been months or even a few years, but the cancer has come back. And most of the time it's coming back in another site. Maybe it's the bone or the lungs or lymph nodes or the liver. But wherever it is, that's disease we want to treat. We know that's a marker for the cancer getting into the bloodstream and spreading to other parts of the body. And it's not always simply those spots, but disease elsewhere. So we're going to use therapies that go everywhere. And historically, we've had pill therapy that targets the blood supply of the tumor. And it's worked. It's worked in the majority of patients to slow the cancer. But inevitably, the vast majority of those patients progress. We've looked at how patients progress, and now we're starting to study, in just the last few months now, we've seen data suggesting that there are some newer drugs that target additional pathways that control that cancer for longer periods of time, particularly the most aggressive tumors. And that's what, to me, I'm most excited about, because if we can tackle the most aggressive forms of kidney cancer, well, we're going to be doing even better against the less aggressive forms. Those are always the hardest tumors to treat, are the ones that are growing faster or causing symptoms or spreading to more sites. So those are the kinds of signs that will tell us they're aggressive. And we'll use these pill therapies. Now this new pill therapy called cabozantinib that has shown greater activity and longer duration of control of cancer in this population. Additionally, there have been some data now, it's not FDA approved yet, but there's some immunotherapies that suggest that they could work as well in this sort of high risk, aggressive cancers that are more likely to kill the patient sooner because of the pace of the disease. And there too, targeting the immune system, not totally different mechanism, using IV therapies to stimulate the immune system to fight the cancer, have worked, not necessarily in everybody, but in a subset of patients really dramatically. And that's always tremendously helpful for patients, because everybody wants to see a dramatic response. And we don't always get that. But now if we've got several different shots on goal, if you will, several different opportunities to get that exceptional response, that gives people hope, not just with the first treatment, but the second or the third as well. And I've seen that. I've seen patients who've progressed through 1 or 2 lines of therapy then get a dramatic response to something, their third time through. So that's not always the case with cancers. But with kidney cancer, it seems to be a cancer where if we keep plugging away at it, every once in a while we'll get another breakthrough. And right now, this last year or so, we've had a couple of breakthroughs. And I don't think we're done. I think we're going to see more. So the longer this generation of patients can live, I think the more they'll benefit from these therapies.